to introduce myself, I'm Darlene with SeniorLivingGuide.com. A little bit about SeniorLivingGuide.com if you're unfamiliar with what we have and offer to our clients and also to our seniors and their caregivers is we are very multifaceted. We have a national reach website that provides our online users with an ability to pick and choose the community that they're really interested in, and they connect directly with them. It's a great resource for them. And then also it's a great way for our clients to get leads that are specifically for them. And those leads are not shared with other communities for our specific clients. So it's a really great way to, we're really different from a lot of other like lead generation websites. So if you're haven't visited our website, please do. And then we also have print products in Florida, North Carolina, South Carolina, and Virginia that are statewide print products that are great for seniors and caregivers. And then we also have hospital directories in, I think, 45 markets. And we also have a senior caregiver and resource podcast, senior caregiver and senior care podcast resource that can be found anywhere you listen to music, such as Spotify, Apple Podcasts, or anything like that. So it's a great resource for you there as well. And also, we do these industry professional webinars. If you are interested in finding out more information on how you can work with us, please connect with me, because we really do have some amazing resources. We're flat monthly pricing. We're not going to charge you per lead. We're not going to sell your leads. It really is a great opportunity to just get some great leads and work with us on a one-on-one basis. So get in contact with me after this webinar and I can tell you how that works. And that's pretty much my spiel. Anyway, so Liz, why don't you go ahead and tell the folks a little bit about yourself before we get started?
Sure. So my name is Liz Odhwani, but I go by Liz. It's a lot easier. I'm with the Social Security Administration. I've been with the administration for 20 years now, more than 20 years, actually, if we're counting beyond my anniversary date, which was June the 30th. And so I've worked in a lot of different offices. I've done a lot of different claims. I've worked in the Atlanta, Georgia office. I know we have a few representation here from every state. So Atlanta, Georgia. I've worked in Dallas, Texas, Houston, Texas. I know we have a few Texans on the call as well. And also worked all over Virginia. So I know Richmond, Virginia, all of their counties, Chesterfield County, I was there, Petersburg, I worked there. Downtown Richmond, I work there. And then also now I'm in the Tidewater area doing public affairs. So I'm no longer in an office doing claims. I'm out and about. Well, right now, webinars, because we can't go back out as frequently as we could before COVID. So now I'm doing more education and outreach in the community. So you are definitely in great hands when it comes to these topics. Like I said, I've been doing this for over 20 years and over 17 years with the Medicare and Social Security portion of it. Prior to that, I was more disability. So, so that's what I've been doing. That's my life. I graduated from VCU and just started the job right after. So definitely, I love what I do. Hopefully you'll be able to see that as well. And afterwards, you're more than welcome to ask any general questions, nothing specific. We don't want your personal identifying information out there, especially in this day of age. So anything general you could always put in the Q&A and I could answer that for you. So yeah.
And Liz, we really want to thank you for joining us today. This is your second webinar and you've done a podcast with us as well. And everything that you've done with us, just the feedback has been off the chart, positive. So it's a blessing to have you on with us today. So I just wanted to share that with you. Thank you so much.
Thank you. Thank you so much. So I guess we could get started, right? So
yeah, absolutely. Let's go ahead and get started.
Okay, so as you can see, the first slide talks about what is FICA. And FICA, if I know you've been working paying into Social Security, you might be a case manager, somebody who's helping seniors, or somebody who's a senior yourself, or somebody who's just working. You've worked and put into Social Security, or you're thinking about working, right? Because you might be an intern or something. You might be starting your job search right now. FICA is the Social Security tax. So when most people say, oh, I've been paying Social Security all my life, there's not a separate tax like you pay with the IRS. Like, you don't have to do it per quarter unless you're self-employed. If you're self-employed, then you do have to pay it separately. But if you're working for a company, you are getting a W-2, or you're working, getting a paycheck, or you are with the military, even you're a federal employee, a state employee, most of the time you are working, you're paying into Social Security taxes. Now, that's a tax that's automatically taken or deducted from your paycheck. Okay, but not only do you see a deduction on your paycheck when it comes to FICA or Social Security tax, it's called different things. FICA stands for Federal Insurance Contributions Act, so that's one of the titles that you might see. Another one, you might just see Social Security, and then you might see a line that says Medicare. You might see a line that says OASDI, Old Age Disability, OAS, so Social Security, OAS, Disability Insurance. So again, OA, Old Age Social Security Disability Insurance. So you might see different titles on your pay stub depending on how your employer does it. But you'll notice that there'll be a deduction and a contribution on every paycheck you receive. Okay, if you're self-employed, you have to do it. You have to deduct it and you have to contribute towards yourself. So it does double. But it is a deduction and a contribution. And it's a 7.65% deduction, okay, every paycheck based on your gross wages before taxes, before anything is cut. Now, this here breaks it down a little bit. It's federal. It's a federal tax, okay? It's an insurance. The more you put in, the more you get. So the more you work, the more you gross, the higher the 7.65% portion is, right? Because 7.65% is a percentage. It's not a dollar value of $10 or $20 every check. It all depends on how much you worked, how much you paid into it. So 7.65%. Federal insurance that not only you contribute towards, but your employer also contributes towards it. And it's an act, because it's a federal act, part of the New Deal that was passed over 87 years ago. I'm going to say 88 years ago now, with Franklin D. Roosevelt during the Great Depression, so people could retire with dignity and respect. So that was the purpose of the New Deal. I was actually listening to Bernie Sanders, or one of the senators. They were doing something with Social Security, trying to figure out, different things that they could do to keep it solvent. And he actually mentioned, or they actually mentioned, which both parties agree, that if it wasn't for Social Security, more than 50% of our seniors would be dealing with poverty right now. So not only has it been helping for 87, 88 years now, hopefully it will continue to help. And that's why, Congress and senators, and they're all trying to sit together and try to figure out which way to keep Social Security growing. Now, the breakdown of the FICA taxes, out of the 7.65% that you pay and what your employer pays, you're actually looking at over 15%, right? If you look at both of them. And then, but the 7.65%, if you're trying to look at that, 6.2% is your money. So if you remember getting your Social Security statement every year, letting you know how much you've worked and put into Social Security, around your birthday, you would get a statement. Now, we stopped mailing those out because of identity theft. People steal people's mail. Okay, not a good thing, especially if you're trying to get you're probably getting a call telling you your Social Security number is suspended. All of that stuff, it's not true. But again, in this day of age, it's just not good to have your statement out like that. And we stopped mailing that out about 10 years ago now. But you can go ahead and create your My Social Security account. And that's on our website, ssa.gov/my-account. If you create your account, you could see your statements again. Huge. Whether you're just working, you're 18 years old, you want to start looking and preparing for the future, or you're currently working, or you're about to retire. Doesn't matter. Most Social Security employees already have a My Social Security account set up. I have an account set up. I still have a while to go. I've only been doing this 20 years. I still have another 20 years to go. Am I going to remember what I made in 2022? Probably not, when it's time for me to retire, or if I have to file for disability or something in the future. I'm probably not going to remember. So it's always a good thing to just be proactive, create your account. But it's important so you can go back and see if we actually have the right information for you anyway. So if you see that there's a discrepancy on your statement, you go log in, you notice your statement, then you can actually contact the local Social Security office. Now, most of our offices have opened again. April the 7th is when we have reopened. So most of them are open for walk-ins. Or we do have a drop box as well in a lot of our offices. So make sure if you want to go into the office or, drop it off in the drop box, mail it in. You can mail in your W-2, or go into the office with your W-2 and we can get that corrected for you, because that's our job. That's what we were created to do, to make sure you could retire with dignity and respect. That's the whole purpose of Social Security. So again, if you look at the 6.2%, that's your money. So if you look at your statement, you'll notice that there'll be something under disability, retirement, Medicare, family benefits, survivor benefits, right? So that's all your money. And you want to make sure it's, like I said, everything is correct. And then you'll also notice another 6.2% from the contribution of your employer. So that's 12.4% you're getting back. Okay. And then the rest of it, which is the 1.45%, that's Medicare. We're really going to talk about Medicare today, but I definitely wanted to highlight how Social Security is calculated as well. And another thing that most people don't realize is that we also have to take into consideration inflation. If you look at what you made 20 years ago, can you live off of that today? No, right? The value of the dollar has gotten less. You need more money to live. So we have to take into consideration inflation, and we update what you've worked and put into Social Security to the value of what it would be worth when you actually file. Okay, so you actually get an inflated amount, believe it or not, because most of our seniors, about 40% of their post-retirement is based on Social Security. Now, some of them it's 100%, right? They don't have any savings, but about 40% of your post-retirement income could be your Social Security income as well. So many people depend on Social Security, and so we do have to calculate it accordingly. And again, there's always ways to they're still working on ways to try to keep it solvent, and we've had many actual changes throughout the years to keep Social Security solvent. So hopefully that gives you a good rundown of what FICA is, how it's taxed, your employer contributing towards it. We look at the highest 35 years of the last 40 years of work, but you do need to have at least 10 years to get something, okay? And again, we do have to look at inflation as well, so we can keep so many seniors, not over the poverty rate. So that's always a big concern as well. So the next slide is, again, who pays for Social Security? Now, we noticed when Darlene was actually introducing everybody, the biggest thing she wanted to know is where everybody's from, right? And so as you can see on the next slide.
I know, I'm trying to get it to go.
Okay. Do you just can scroll up or no? Oh, there you go.
There we go.
You got it. So as you can see, everybody pays into Social Security. It doesn't matter where you're from, what your religion is, who your political party is that you associate yourself with. It's bipartisan. It doesn't matter what your race, religion, sexual orientation. None of that matters. As long as you work and pay into Social Security, you'll receive it. It's an insurance, right? The more you put in, the more you'll receive, as long as you put in. And that's why, as long as you're 18 years old, involved, you can actually go ahead and create your My Social Security account to see those statements, which is very important. Many young people feel like, oh, it's not going to be around by the time I'm 62. Well, it's been around 87 years and growing, and so it's been very successful. So definitely want to go ahead and let you guys know that it is for anybody and everybody, government workers, a post office worker, anybody and everybody. Doesn't matter what your race, religion, where you work, as long as you work and pay into Social Security, your employer takes out for it, or you're self-employed and you take out for it, then you're eligible. So yeah. Now the next slide is another resourceful slide, and this is called MyMoney.gov. Now this is different than Social Security. If you notice on the bottom of every slide, you'll notice our website, socialsecurity.gov, G-O-V. Now it could be also SSA.gov too, but as long as it's .gov, not .org or .com or .net or anything else, you want to make sure it's socialsecurity.gov or SSA.gov, G-O-V. But another site that we have available is called the MyMoney.gov. Now, Social Security, of course, provides a foundation on which to build retirement security, right? But while planning for retirement, it's also important you know how much your Social Security benefit is likely to be. And that's why you want to be proactive, check out those statements, make sure that we have the right information. You also want to consider how much monthly income you're going to receive from your pension and investments. The rest of your pre-retirement income will need to be supplemented by your savings and other income, right? Social Security by no means says this is the only source of income you need to have. You can have as much income as you need, but if you're filing for benefits prior to whatever your full retirement age is, right, then you can't have, you can't work and make as much as you like. You have to be partially retired. Once you hit full retirement age, though, you can work, make as much as you like as well, but it doesn't care about any savings that you have, any other checks you're receiving from another pension, VA, unemployment, any other pensions, any, retirement system, none of IRAs, none of that matters. Stocks, bonds, any rental income, we don't look at any of that. But it is important that you actually are proactive with that, right? Because you want to plan for your future. So the rest of your pre-retirement income, like I said, is going to be supplemented by your savings and other income to help with your retirement income. Again, this is a great a website to visit. It's actually a product of the congressionally chartered Federal Financial Literacy and Education Commission. It's a long one, which is made up of more than 20 federal entities that coordinate and collaborate to strengthen financial capability and increase access to financial services for all Americans. And of course, Social Security is one of those 20 entities, and that's why it's part of my slideshow. Now, this was actually commissioned in 2003. And again, this is just a great website to visit. Even if you already have a financial planner who helps you manage your portfolio, it's going to help you be more informed about financial matters so you can ask better questions to your trusted advisors. And this site is free, reliable, unbiased on a variety of financial topics. As you'll see, it has youth, teachers, educators, researchers, you name it. You could probably find a topic that might be helpful to you or of interest to you. And unlike the investment advice offered by some private financial companies' websites, again, no one is trying to sell you anything. This is free and open to the public. No one is trying to sell you anything. No one is trying to do anything. We're not trying to take your money or anything like that. Okay. Now, the next slide, I'm going to cover Medicare. And as you guys are aware, Medicare has many parts to it. There's 4 parts, basic parts to Medicare. And then, of course, insurance companies will try to sell you E, D, F, G, H, I, J, K. It could go all the way up to Z at some point. Yeah. So, so Medicare Part A, that's part of that FICA tax I talked about. So as I mentioned, 7.65%, 6.2% is your money, right? Your employer matches it, so you're looking at 12.4%, and then 1.45% is Medicare. That's Medicare Part A, which covers 80% of your hospital bills. So you've actually prepaid into this. You're insured for Medicare. So if you look at your statement, you'll notice, if you've actually paid into Medicare enough or not for Part A. Okay. And so that Medicare, again, is for 80% of your hospital bills if you're ever in the hospital for more than 3 days. And again, you've already prepaid into it in the sense you're not paying another premium on top of this Medicare Part A because you've already paid into it with your FICA taxes. Okay. Whether it was broken down on your paycheck or it showed Medicare separately or OASDI for the, insurance, but you will see that it's something that's prepaid. And again, if you do have to purchase it, let's say you haven't paid into it enough. Let's say you were self-employed and you didn't really pay into Medicare or Social Security that much. Whatever the case may be, you have to purchase it. If you have to purchase Part A, you're looking at least $400 to $500 a month, depending on, whatever it is that, depends on how many credits you have. If you have, if you worked about 5 years, you might have to pay less or, pay a little bit more. If you worked more than 5 years, then you'll pay a little bit less. But you're looking at, it's very expensive. In general, it's just very expensive to pay for it out of pocket. Now, unless your state will help you if you have Medicaid, you're low income, then maybe the Medicare, you might not need the Part A because you have Medicaid, which helps you with hospitalization, right? But again, very important to know that you're actually prepaying into the Part A when you're paying into FICA. So rest assured with that. Now, Medicare Part B covers 80% of your doctor's bills. So if you go to a doctor that takes Medicare, that's what they're looking at is the Part B to see if you actually can have that coverage. Now, Medicare Part B, that amount varies year to year. We do not set the price for Medicare. Medicare sets the price for Medicare. However, Social Security, you can sign up with Medicare for us because we have field offices everywhere, right? So you could always sign up for Medicare with Social Security if you don't do it through their website. But you could also, but also if you're on Social Security, they do deduct the Medicare premium from this Social Security check. Okay. But we don't administer the payments for Medicare. Congress does that. And it comes through the Center for Medicare and Medicaid Services. Okay. So they're the ones who set the price every year. And then also, if you have any IRMA, anything extra you're paying for Medicare, all of that is coming from the Center of Medicare and Medicaid Services. But, because it's docked from your Social Security check, if you're on Social Security, then of course, most people associate that with us and also signing up. Of course, you have to sign up for Medicare at some point. So you would go through either Social Security, you could sign it up on our website as well. Even if you're not ready to file for retirement, you could sign up for Medicare on our website under SSA.gov or socialsecurity.gov. On our homepage, you'll see a Medicare icon. So it'll help you sign up if you're ready to do that. And again, there's different periods that you would sign up for Part B. Now, you don't have to take A and B at 65. I'm going to go over that with you. But if you're not on Social Security checks yet, let's say you're waiting until you're 66 or 67 or, want to wait until you're 70 because delayed retirement credits isn't, it just stops at 70 or full age is 66 or 67, depending on the year you were born. You might not want to take your benefits, right, your money yet, right? But you want your Medicare, right? So if that's the case, you can file for Medicare, directly as well. And you could even contact our offices to do that or, go into the office or do it a phone appointment. So there's different ways to sign up for Medicare. Now, Part C, so I covered 80% of hospital bills, 80% of doctor's bills, right? So this 20%, right, are your Medicare Advantage plans, which could be your private companies, AARP, Humana, Blue Cross Blue Shield. I think they usually do a renewal around October. That's why most people think you have to do Medicare around October. No, we have a different enrollment period. We have different times you can set it up, eligibility and all that. But with the private plans, Humana, AARP, Blue Cross Blue Shield, TRICARE for life, if you're military, if you're a veteran, you and your spouse might be under TRICARE for life. If you're already under TRICARE Prime, that's going to be your Part C. So that's closer to when you turn 65, you get all sorts of things in the mail, right? That's going to be, right, all of that. So that's all going to be your Medicare Part C. So they want your business. So
Right.
even if you're working and you're insured under your group health insurance plan or your spouse's group health insurance plan, and you choose not to take Medicare right now because you already have the insurance, why pay for 2 premiums, right? That's one way you can opt out of it. You don't have to take the Part C, okay? Because again, they want to make sure you're covered the 80%, right? So they can cover you for the other 20%. So up to you. It's a personal choice. It's insurance. However, that is the Part C piece to it. Now, the Part D is your prescription drugs, your medicine, right? So D, I always associate D for drugs. And this was something that was actually passed during President Bush the son, the President Bush, I call him, Junior. So I actually, so this was around that time, and I was around when it was put into place, where it would help. Medicare Part D is a separate Medicare plan where you would pay for prescription drug coverage. It usually goes hand in hand with the Part C, which whoever you pick, or it could be through TRICARE for Life. They might have a prescription drug plan with their coverages. And pretty much around 2006, President Bush Jr., he actually passed the subsidy for extra help. So if you know somebody who's low income and they can't afford that extra Part D, prescription drug cost coverage, if you go through Social Security, we actually have a financial screening, and you might qualify for extra help. So we'll help pay or subsidize that Part D premium for our beneficiaries. And again, more information on that, you could go to socialsecurity.gov/extra help. Okay, if you're interested in that. So that's always a good thing. Now, the next slide I'm going to go over is
so I did have a question for you as you're kind of going through this. So the Medicare Advantage plans covers the 20% that Part A and B do not cover, correct?
We cover 80%. So it all depends on billing. So if somebody was to get sick, they're in the hospital or they see a doctor, they'll give them the Medicare plan, they'll give them the other insurance plan that they have, and then it'll be billed accordingly. But we would cover 80% of that bill.
Okay. And the Advantage plans, it might depend on whatever plan you get, would cover what Medicare doesn't cover to whatever that plan specifies, correct?
Right. Yeah, that's up to the plans.
Okay.
Yeah, whatever plan you choose.
And then those plans can include that prescription, the Part D, that can be an option.
Right. So they might
not necessarily include it.
Exactly. Yeah, that's going to be a separate option that many beneficiaries choose. And then again, if they're lower income, that's good. It could help with that cost. Social Security could help with that.
With the extra help plan. Okay. I just wanted just to clarify it as we were going.
Oh, no, that's great. I'm glad. Thank you. These follow-up questions really help. They really do. So the next, Medicare eligibility. So as I said, most people think of, renewing their plans or, getting on a plan. They're in October. That's going to be with the private industry. Humana, AARP, Blue Cross Blue Shield. TRICARE doesn't have that issue, but a lot of other ones do when you're trying to renew your plan or something. But Medicare eligibility is various times. You don't have to do it right at 65. I'm going to go over some things, but it could be if you were on Social Security disability. You worked and put into Social Security. You become disabled. You're not 65 yet, but you become disabled. If that's the case, if you're, let's say you're 45, and you become disabled, something has happened and you can't go back to work. You have worked and put into Social Security, so you apply for the disability because you checked your statement, you're eligible for disability. So after being on Social Security disability for 2 years, when you turn 47, because you were 45 when it started, the benefits started, you'll get a Medicare card in the mail. And it's up to you. You could actually keep it if you want, the A and the B at that time, or you could give it back. Okay, now I'm going to go over why you might want to give it back, right? But that is an option you have. So Medicare eligibility only isn't at 65. It could be earlier than 65 if, let's say, you've been on disability in the past or before 65. Now, of course, most people think of Medicare at 65, and that's still the case. So Social Security, if you remember back in the day, it was 65, right? You took your Social Security, you took your Medicare, you were one and done. You took your money, you took your Medicare, you were done, happy retirement. But to keep Social Security solvent, people are living longer, they did increase the retirement age for people to draw money, the money part, okay? Medicare is still 65. You can still take it at 65. You don't have to be longer, older for that. But if you want to draw your benefits, your checks, you can draw them as early as 62, okay? And if you're working, as I said, you can't work and make as much as you like. You are under a yearly limit if you're working part-time. So this is only for people that are working. If you have other checks coming in, other savings coming in, your spouse is working, that's fine. But as long as you, the beneficiary, are under full retirement age, you can't work and make as much as you like. But you can start taking your benefits as early as 62. Now, full retirement age is the age where you could work and make as much as you like, okay? So that's where you have no limit of wages if you're working, okay? And full retirement age has increased an extra year, pretty much. If you were born after if you were born between, I think it's 1940 something to 1954, your full retirement age is actually still 66. So it's no longer 65, it's actually 66. Once you hit if you were born in the mid 50s, so if you were born in 1955, 56, 57, 58, or 59, your full retirement age is a combination of maybe 66 and 2, 4, 6, 8, or 10 months, okay? Depends on if you were born in the mid 1950s, mid to late 1950s. Now, if you were born in after 1960, okay, then your full retirement age is 67, okay? Again, does not mean you have to wait till you're 67 to file, okay? You have a span between 62 and 70. All right. But a lot of people might wait until full age because they want to work, they want to make as much as they like, and they want to draw their check without any penalties, right? Without any hassles. So that's full age. And for every year you wait past that, you get an 8% increase, okay? So if you wait until you're 70, okay, you'll get a 32% increase because between 66 and 70 is 4 years. 4 times 8 is 32, right? So a lot of people might want to wait till they're 70, but it really depends on you, how long you plan on living, what your health is like. That's more of a personal decision. Right. But you have options there. But 65 is still Medicare. So let's say you took Social Security benefits prior to 65, okay? You don't have to do a thing. You'll get the Medicare card in the mail automatically. Again, up to you to keep it or give it back, okay? You can keep the Part A, you worked and put into it, right? So you might just refuse the Part B, both cases, whether you're disabled and receiving a check or on retirement prior receiving a check. So you can choose to, sorry about that. You can choose to go ahead and, just keep the Part A, right? But then the Part B, you can defer it because you have to pay for Part B separately, right? And I'll explain why you might want to do that. Now, the other, and if you're not on Social Security yet, but you want to get your Medicare, right? Then you can apply for Medicare without being on checks. And again, you can contact the office to do just your Medicare claim. You could call us, you could do it online, you could go into the office and speak to a rep and see if they can do it as a walk-in, if they have availability. If they don't, then they might set you up a phone appointment, but you can still do the Medicare portion of it at 65. Now, a couple of other ways you could get Medicare is if you were diagnosed with Lou Gehrig's disease, so ALS.
Oh, wow.
Or if you don't have to wait for that, but you do have to apply for cash and disability benefits due to that. And then the other one, without applying for cash benefits, you can opt out of not getting the monthly checks, but you still need your Medicare. could be for kidney dialysis. So if you're going through kidney dialysis, going through a transplant or renal, end-stage renal disease for your kidneys, you can apply, and it doesn't matter if it's for you. It could be for your spouse. You might have worked and put into Social Security enough, as you notice on the statements, there's something called family benefits, right? So it might be for a spouse that's going through it, but they haven't worked and put into Social Security enough. It could be for your child that's going through it. Proof of relationship makes a difference with Social Security and Medicare. So you might have a child that's going through kidney dialysis, but they haven't worked. The parent can apply to get Medicare for the child off of their record. So lots of different ways you can get Medicare. Those are some reasons. Very hardly have I seen any environmental health hazard exposure, but it does happen. So if that is something that might be, you could contact the local Social Security office where you are and see if, what that hazard could be depending on your area. Now, the next slide is, of course, enrollment. And I keep mentioning, it's up to you. You could keep the card, you could give the card back. Why do I keep saying that, right? I keep saying 65. So what's going on at 65? So initial enrollment period. Let's say you're on Social Security, you receive a benefit check, you will get a Medicare card in the mail about 3 months before your 65th birthday. Okay. That's really during your initial enrollment period. Okay. If you're getting a check off of a spouse's record, you're a widow, or a spouse has worked and paid into Social Security, so you're getting it off of them, that's fine too, okay? So you'll get it around 3 months automatically. If you're on disability, you'll get it after 2 years of being on Social Security disability. So that'll be an automatic thing. But initial enrollment period begins 3 months before you turn 65, the month you turn 65, and 3 months after, okay? So there's a 7-month window if you're looking at filing under your initial enrollment period if you're not on Social Security benefits yet, okay? So the thing with Social Security is 3 months before you turn 65, you can file. So you can file your application. Most people ask me, how soon can I file for Medicare? Well, if you're looking at 65, you could do it 3 months before you turn 65. You can do it, but it'll be in effect the month you turn 65. So it'll be effective the month you turn 65. Even if you're already on Social Security checks, you won't see a deduction until your 65th birth month. That's the month you'll see the deduction for. And your card will even have the month you turn 65, okay? And it'll be 3 months. You can get it 3 months before, the month after, or 3 months, or sorry, the month of, or 3 months after, without having any penalties. Okay. Now, initial enrollment period is for people that do not have, are not currently working, not insured under their group health insurance through their job, through their current job. So let's say you've worked in the past and you've carried your previous employer's group health insurance plan. Will that apply to you? Yes. You do need to file for during your initial enrollment period if you're not on benefits yet, or if you're on benefits, you might want to keep that card because you don't have insurance through a current employer or a spouse's current employer. The only exception is where you can delay your Medicare is your special enrollment period. Okay. And that's where you at 65, 66, 67, you were working, you are insured under your current employer's group health insurance plan, or your spouse was working and you were insured under their current insurance, group health insurance plan, then you could delay it. Okay. So if you're 65 or older and covered under a group plan based on your or your spouse's current work. Okay. So when you're talking about penalties, most people think you have to take it at 65 or you'll have a penalty. This is true if you do not have insurance through a current employer or a spouse's current employer's group health insurance plan. So unless you fall under special enrollment period, you do want to file during your initial enrollment period because you don't want a penalty for it's a 10% penalty for every year you wait past the age of 65 if you did not have insurance through a current employer or a spouse's group health insurance plan through their current employer. So again, that's how initial enrollment works, special enrollment works. Now, general enrollment period, they are working on that. It's no longer going to be from January through March. The year after you come into the Social Security office, or so let's say you turned 66, but you didn't take Medicare at 65. You didn't have insurance through a current employer or a spouse's current employer, then for every year you wait, there's a 10% penalty on top of the premium for that year. So Part B, the what I talked about with the doctor's insurance, you have to pay separate for that. This year, that premium is $178.80. Last year, it was $148. Again, these prices are set by Medicare, okay? So we're looking at about a $30 difference, right? So it goes up every year. But not only will that be something that might be deducted from your check or something you have to pay out of pocket because you don't have a Social Security check yet, so you'll go through direct billing with Medicare, if that's the case. But for every year you wait, you're looking at a 10% penalty on top of whatever the current premium is. So if you waited 2 years, you're 67, you're going to be paying 20%. You wait 3 years, you're going to pay 30%. So you don't want to be in that situation. You don't want to be in a situation where you're under the general enrollment period, but you do want to go ahead and file during initial enrollment period if you qualify under that, or special enrollment period if you have insurance through a current employer or a spouse's current employer past the age of 65. So definitely wanted to highlight the difference there. Now, the next slide is Medicare Part B coverage if you enroll in this month of Medicare. So when I talked about the 7 months, right? Some people actually want to, they think about their retirement close to when they turn 65. So this might be helpful. This chart might be helpful when you're planning when you actually do want to retire from your job, right? Because you have insurance through your group health insurance plan, but you don't want to overpay, right? Why pay for 2 premiums when you don't have to and you're about to retire, right? So how do you plan that? So if you take it 1 to 3 months before you turn 65, it'll be effective the month you turn 65. So you have that window, the 3 months before you turn 65, so it could be in effect for the month you turn 65, okay? If you take it on your birth month, the month you turn 65, it actually goes into effect the month after. So if your birth month is in August, it'll start in September. Okay, that's how that works. Now, if you do it 1 month after you reach 65. So let's say you do it in September. Your birthday was in August, but you applied in September. Okay, it's going to be in effect 2 months after the month of enrollment. Okay, so it'll be effective November. Okay, now again, if you do it 2 or 3 months after you turn 65, and then that later 7 months, then it'll be 3 months after the month of enrollment. So if you go ahead and do it in October or November, you'll wait an additional 3 months so you can go ahead and be effective for that. So again, this is a good little planning chart that you might need if you're looking at retiring at 65, but you don't know how does that pay, how do you enroll for Medicare and when does that go into effect. Now, the next slide is just letting you know that we are not, believe it or not, like I said, we're not Medicare, we're Social Security. So Medicare does have its own website, and you can actually create a MyMoneygov account. So if you have your Medicare number and the date that you were enrolled when you received your Medicare card, you could actually go ahead and create your MyMedicare account as well as my Social Security account and a MyMedicare account. And this will tell you about your Medicare costs, your coverages, your supplements, other insurance, claims, appeals. So it's very helpful. And again, this is through the Center for Medicare and Medicaid Services, okay? Now, the next slide, I already went over a little bit under the Extra Help program. So Medicare beneficiaries may qualify for extra help with their Medicare prescription drug plan costs. And again, that would be worth about $4,900 a year to people that might be eligible for that subsidy because of their lower income and lower resources. So that would be socialsecurity.gov/extra help. Now, the next slide, this is a piece that would play with the special enrollment period, okay, the form. When I mentioned earlier that you actually would if you have insurance through your current employer or your spouse's current employer, right? You don't have to take it at 65. Well, how do you prove that? How do we know that, this is an act that you're actually telling the truth? So we do have a form that needs to be filled out by your HR, by your human resources. Okay. And if your spouse is under your group health insurance plan through your current employer and they're past the age of 65 to prevent penalties, you would do a set for your spouse as well. Okay. So these two forms, the 40B, the CMS 40B, and the CMS L564 are both on our website. So if you go to socialsecurity.gov, you scroll to the bottom of our homepage, you'll see an icon that says forms. You click on forms and you could scroll down and you could find the CMS 40B and the CMS L564. So these are like your golden tickets. This is what you need to make sure. In fact, the L564 is what your HR fills out. Okay. So make sure, if possible, they can fill it out for you. You can go ahead and apply for it online. And you could either scan this in, or if you have a W-2 or a pay stub or something from your employer showing that you're no longer insured, but you were insured up until this date and you were working up until whatever date, then you could use that. You actually have an 8-month window so that you can, if you lose your job or something happens or you hadn't planned on taking Medicare yet, you have an 8-month window to go ahead and file for special enrollment period if you're no longer insured with a job. But definitely these two forms are very important, easily accessible. And of course, the L564 is the one your HR will help you fill out. The 40B is what you fill out stating you're requesting Medicare, right? Without your request, we can't do anything. So we do need that as a formal request. And then the L564 is what your employer fills out. So the next slide, that's another Medicare.gov site. So again, I guess they keep renewing it, so that's always nice. But again, on the I think it's the right-hand side, you'll see login, create account. So that would be your Medicare.gov account. Now, the slide after that is your Medicare card. This was changed back in 2018, 2019, it used to be your social security number, right? But because of identity theft and everything that's going on, Social Security, the Center for Medicare and Medicaid Services, actually resent over 61 million beneficiaries that were already on Medicare at the time, new Medicare cards with an alphanumeric number on it, so that you're no longer walking around.
I love that.
Because everybody walks around with their insurance cards, right? And you don't want your social on it, right? So just like DMV, they changed their customer service ID numbers with an A number or a T number, same thing, or an alphanumeric number. Same thing with us. We actually changed it up for an alphanumeric number, so you're not walking around with your health insurance card with your social. So the next slide is.
So again, I do have a question for you. When you have the Medicare card, do you present your health insurance when you go to the hospital, do you have to present your Medicare card and your supplemental card as well? Do you have to present them both?
I would submit everything, because you don't want to pay for anything out of pocket if you have the insurance for it, right? Okay. So all your insurance cards would be helpful, and they'll bill it accordingly. So absolutely. Okay. Yeah. And so all of these, all of this is available online. You could file for retirement online. You could file for Medicare online. You could file for disability online. Again, if you just go to our homepage, you'll see the links on the top of the page that say retirement, Medicare, supplemental security income disability, or SSI disability. You could actually file for this online. Spousal benefits as well. And then we could do another one just on benefits, money. That's fine too. But you could file for Medicare online. It's under socialsecurity.gov/Medicare if you just want to get to that directly. You can call our 1-800 line, 1-800-772-1213. That's our national line. They're available from 8 a.m. to 7 p.m. So let's say you just couldn't do it during normal office hours, business hours, you could call us, 1-800-772-1213. Again, that's available from 8 a.m. to 7 p.m. every day, Monday to Friday. Our local offices are available if you want to contact them Monday to Friday from 9 to 4. If you don't know where your local office is, you could use the locator link. That's www.ssa.gov/locator. And you would be able to find your local office's phone number as well if you don't want to go in. And maybe you could try to see if you could talk to somebody on the phone. So you have that option as well. Now, the next slide is my favorite slide. That is our website. Okay. And again, as you can see, it has a lot of links there: retirement, disability. They did change it up. So the employers and the get to know your Social Security is actually replaced with disability and supplemental security income and Medicare. If you notice on the left-hand side below the picture of online services, putting you in control, learn what you can do online. On the left-hand side, you'll notice the My Social Security, you'll notice the link for going right into My Social Security to create your account. We have 11 different calculators online. And the next slide tells you why you want to create an account. Number one, if you go to the next slide, it tells you socialsecurity.gov/my-account. That's the URL for that if you want to go directly to that. And the slide after that, if you're on benefits, right, you can update your address, your phone number, your direct deposit, get your 1099 for taxes, get your Medicare card replaced. You could get, like I said, your proof of income letter to show how much your Social Security is if you need it for housing or any other benefits you're filing for. So lots of different things you can do right from your fingertips, from your home, if you create your My Social Security account, if you're on benefits. Because why waste your time on the phone, or why wait in line when you could do some of these transactions right from your home, the comfort of your home? Now, the other thing you can also do, whether you're on benefits or not, is you could get your Social Security card replaced. If you're over the age of 18 and a U.S. citizen and you just lost your card, then you would just log in, go under replacement documents, put in your driver's license information or state ID information. So you have to be over the age of 18 and a U.S. citizen. But you can go ahead and request it for free. We're not charging anybody any fees for that, because I know there's a lot of websites that'll pop up and say, pay us $25, or, this is absolutely free. Create your account. You can actually, and if you lose your Social Security card or you need a replacement, you'll get an email with that same receipt you used to get when you go into the office, letting you know the card will be there. It will be coming to you in 2 weeks. You'll get an email. So you could print that email to whoever you need to show it to, because maybe you're looking for a job, and you need your Social Security card. So that's proof that you applied for one, and you'll have it in 2 weeks. It'll come to you in the mail. And I know it works because I've had family members try it and clients try it as well. So lots of different things you can do if you already have benefits. The next slide. Well, what if you don't have benefits, right? Well, you could still get your Social Security card replaced if you're over the age of 18, right? U.S. citizen, and you just need a replacement. You can look at your statement to see how much, you would get if you filed, how much you worked and put into Social Security all your life. So you get to see your statement. If you applied for benefits, you could know the status of your application. If you filed for retirement or Medicare or something else, you could log in, and instead of being on hold or disability, you could actually go ahead and log in and look at the status of your application or an appeal if you filed an appeal. And again, you could see if you worked enough and had Medicare, for Medicare and all of that. And if you need a proof of income letter to show you're not on Social Security because you haven't started taking it yet, then you could actually print that out as well. So it works both ways. So again, you might need it because you're filing for something. It's a good way to, get that letter. Now, the next slide is just quick. And again, it doesn't matter as long as you're over the age of 18. It's a good thing to have your My Social Security account. Again, every time. No worries. Every time you log in, you will get a text message or an email. We do have third-party external sites that could verify you. They're vetted from the government, so military. So it would be login.gov or ID Me. So definitely, again, great for anybody over the age of 18, especially if you're working, to track your earnings, or you never know, you might need a Social Security card. You might be looking for work. So it's good to have that way as well to get that. Now we're all over social media, as you can see, Facebook, Twitter, Instagram, LinkedIn, YouTube.
Who's not? Who's not?
Exactly. Exactly. And the next slide just lets you know that we do have public affairs specialists all throughout the nation that do education and outreach in the community. So if you want to contact one of us, more than welcome, and we'll be happy to help with a webinar. If we can come in, we'll go in, but most of us are restricted to webinars right now. But yeah, that's it. So thank you.
Okay.
Thank you so much.
Thank you so much, Liz, for joining us. And I want to thank everyone that has been on the webinar today and attended the webinar today. Thank you so much for joining us. SeniorLivingGuide.com. Thanks you for your participation. And everyone, have a great afternoon. Thank you, Liz.
All right. Thank you. Thank you. And I'll just send you a copy of the PowerPoint we did and some resources that might be helpful. And I could even add the retirement stuff too, like the links and stuff. So that would be helpful. So yeah.
Yeah, perfect. And we'll get that emailed out to everyone that's attended today. So be on the lookout in your email.
Sounds
all right.
good.
Thank you.
Thank you. All right. Bye.
Bye-bye.